Every year, it is reported that 20 to 40 people in New Zealand contract listeriosis from food they consume. While the numbers are small, the outcomes can be devastating, particularly for pregnant people and their unborn babies. Other foodborne illness, such as toxoplasmosis, can cause significant harm. Unsurprisingly, there is a long list of foods to avoid during pregnancy, recommended food handling practices to minimize risk of exposure, along with standard food safety protocols at the production level, which I'm sure you are all very familiar with. Yet beyond public health campaigns and food recall notices, we have an additional line of defence. Our sensory system has intervened and evolved a protective mechanism so powerful that it can cause an individual to completely change their eating behaviour for weeks or months during their pregnancy. You may be familiar with morning sickness. It is estimated to affect 70 to 80% of pregnancies and causes nausea, vomiting, and novel food aversions, often towards meat, fish, poultry, eggs, and bitter flavour compounds. In an era before refrigeration or sanitation, having a strong aversion to foods that are frequently associated with foodborne illness may have been advantageous, but I challenge you to ask any individual experiencing these symptoms whether they think it is advantageous. They will most likely say no very firmly. So, is it a prehistoric hangover? Individuals experiencing these symptoms are also more likely to experience depression and anxiety, and severe morning sickness has been associated with a decrease in energy intake and a decrease in diet quality in early pregnancy. An aversion to fish, for example, may limit an individual's intake of omega-3 fatty acids, zinc, and iodine, all of which are essential for a developing infant. Yet, there are benefits associated with it. A systematic review from 2014 shows morning sickness is associated with significantly reduced risk of infant loss, congenital defects, and premature birth. And a recent study has shown that only 12.9% of individuals surveyed adhere fully to the New Zealand Food Safety in Pregnancy guidelines. An aversion to ready-to-eat meat products, for example, could protect an individual against exposure to listeria. Given the increasing consumption of convenience foods and concern regarding antimicrobial resistance, maybe we do need some extra help. Thank you.